So for this video, we're going to be looking at a PAIVM assessment, otherwise referred to as a passive accessory intervertebral test. And so what we're going to be doing is really looking at the interplay of each vertebral segment through the lumbar spine. Now, before we even begin, we need to ensure that we are approximated to our patient. And so we're going to ask the patient just to slide a little bit closer to us on the table. What this enables us to do is to get our line of force directly over the segment that we are working on. And there really are two techniques that we can use here. One is a thumb-to-thumb technique. This is helpful when we are targeting more of a unilateral focus. And then a pisiform technique where we're able to get a purchase really right on the spinous process of our target segment. In order to identify kind of where we're at, we can either use a bottoms-up approach or a top-down approach. Now, if we palpate down and find the angle of the ribs and come midline, that tends to correlate with approximately the T12-L1 interspinal space. Additionally, we can also find our iliac crest, come around, and that correlates with our L4-5 interspinous space. Again, it doesn't matter so much that you start top down or bottoms up, just so that you're consistent. If we start down here at our L4-5 interspinous space, then initially we're going to start on L5, and I prefer a pisiform grip such that I can get my line of force up and over, and then use my other hand as my mobilizing hand. And so here I have good purchase of the spinous process, and I'm ready to make my assessment all the way. And then I can grade if need be. Okay. Throughout each of these, we're going to be asking our patient good, better, or worse. Or we can also say better, worse, no different. All right. Since they're not looking at us, we can't see their face, it's important that we remain in close communication with them throughout. We're going to come up to L4, find our segment, go all the way to end range, and then back off. And then from there we can assess. Come up into L3. Again, same procedure, and then off. We can work all the way up. This is a central or CPA, posterior to anterior. Our second assessment technique is where we're going to find our facet. Now for this, recognize in our lumbar spine, our facet joint is going to lie on either side, and we have kind of this spinal gutter or this space where we would find the lamina, but the paraspinals are running on either side. And so for this, we need to move a little bit more than a thumb width to the side. We're going to find our spinous process, come to the side, and if we're on the left-hand side here, we can use that thumb-to-thumb approach, and then provide our assessment there. Come back, find L4, find the facet joint, provide the assessment there. And again, we can work all the way up and then work all the way up. Additionally, some clinicians will go side to side. They'll focus on one level, then go to the opposite side. One level, go to the opposite side. That is also a fine technique. But again, have a go with this assessment technique. This is a PAIVM assessment where we're looking at our central PAs and then our unilateral PAs. Let me know if there's any questions.